Welcome to My Spoonie Sisters, featuring stories from special guests dedicated to empowering those with chronic illness. Our goal? To connect people and provide the support and tools they need to live a better life. For those with chronic illness, our energy levels just fade faster. We must be more purposeful with the spoons allotted to us. So grab your coffee or tea, sister, and tune in as My Spoonie Sisters share stories of living with chronic illness. Hi, my Spoonie Sisters. I'm your host, Gracefully Jen, and I am thrilled to bring to you Taleena, my special guest. Hi, how are you today?
I'm good. Thank you for having me.
So Taleena is here to talk to us about something that she is extremely passionate about. Excuse me as I trip over my words. You're an advocate for people with lung disease called pulmonary fibrosis. What led you to become involved in the community?
Back in 2001, my mom, who lived in Montana at the time, and I'm actually in the Washington area, my mom was getting sick frequently and in and out of the hospital with pneumonia. I was trying to help her long distance. And for the next 2 years, that's kind of what we did. She spent that 2 years in and out of the hospital, like I said, frequently ill. And she had been put on oxygen by her doctor for COPD. She had emphysema. She was a smoker of 45 years at that point. So she quit smoking. She quit smoking cold turkey at 47 years of smoking. But she had still only been diagnosed with emphysema, and she wasn't really doing well at all. And I finally convinced her to move out to the Seattle, Washington area. So I got her out here, and 2 days after being here, we had her in the hospital, and she was in congestive heart failure. They took care of her there. We got her to a cardiologist, and we were getting her CHF under control, which was good. But she wasn't getting better. She was still having problems. She was really having problems breathing, even being on supplemental oxygen. So I started doing some homework, and I found out that there was a good pulmonology clinic at University of Washington Medical Center in Seattle. So her and I talked to her doctor and asked her doctor to refer her there. Her doctor actually said no at the beginning, because at this point, my mom was already on disability and she was on state Medicaid. And the doctor said, no, we can't send her there. She's on Medicaid. And I told the doctor I've already called the hospital, and they actually take Medicaid patients. They take anybody, actually, even if you don't have coverage. So he referred her to University of Washington Medical Center to the interstitial lung disease department. So she started seeing a doctor there in August of 2003. So we'd already been doing this for 2 years. So she saw the doctor in 2003. She was seeing a fellow in the department. They started running all sorts of tests, and we spent from August until November trying to figure out what was going on with her. They talked about scleroderma. They talked about pulmonary hypertension, which I knew of because I had a friend who had died of PH. So I knew a little bit about it. The biggest concern we had was that she might have had lung cancer. And finally, they said they needed to do a lung biopsy. So at the end of October, on Halloween, 2003, they did a lung biopsy. And we didn't get those results back until the day before Thanksgiving in November. We went into the exam room and we sat down, and a different doctor walked in the door. And he introduced himself, said he was Dr. Ganesh Raghu, and he was the head of the ILD department. And he sat down and he said, so we've gone through your biopsy, and you have a lung disease called idiopathic pulmonary fibrosis. And neither one of us had ever heard of it. And so we asked him, what is that? And he said, IPF is a progressive lung disease that is terminal and has no treatment and no cure. And we were stunned, like most PF patients and caregivers are. And so we asked him point blank. My mom and I are very blunt. We're very much into wanting the answers. We want the truth. We don't want somebody to pussyfoot around it. We just want to know. So we asked him, how much time does she have? And he said 2 years at best, quote unquote, 2 years at best. And this was in 2003. So we talked to him a bit about the disease. He explained to us what the disease was. He explained that it was idiopathic in the sense that they couldn't find a cause for mom having this disease, even though she had been a smoker for 47 years, even though she had worked in plastics plants, manufacturing, smelling all of those vapors and stuff that come up with plastic, even though she had worked with her ex-husband doing drywall, all kinds of, building maintenance and everything. They had completely gutted and redone an apartment building. All of this stuff, they could not find anything in her lung tissue that indicated a cause for this. They couldn't find anything in her blood, no autoimmune diseases, nothing. So she was diagnosed with idiopathic pulmonary fibrosis. So this started us on this journey. We learned that IPF is really scarring of the lung tissue. So what's happening is the lung tissue gets damaged for some reason, and our bodies create a scar to fix damage. That's just the normal course of, you get a cut on your finger, you get a scar when that cut heals. That's how the body heals. So in the case of the lungs, she had scarring in her lungs. And what that means is that lung tissue that's becoming scarred is actually becoming stiff, almost not as stiff as a rock, but very much kind of rock-like. When you look at a lung that has pulmonary fibrosis, it kind of looks like a lava rock. Like you see all these little holes and stuff. It's very bizarre. So mom was having scar tissue that's, taking over her good lung tissue. And when this happens, you can't, the lungs are not releasing the carbon dioxide. So you have too much carbon dioxide, not enough oxygen. So patients with IPF need to be using supplemental oxygen, which mom already was because she had emphysema. And Dr. Ragu did say that, yes, she does have emphysema, but that wasn't her biggest problem. Her biggest problem was IPF. So we talked about it. He wanted to put her on some medications to try to slow it down, knowing that there is no real treatment. These are all just, completely just the doctor can try these different things. So, we had prescriptions for those medications. We had her oxygen, the reason she was having problems breathing is because she wasn't using enough supplemental oxygen. So he got her on the right liter flow. So she was breathing better. That happened quickly. And we left and we went home. We didn't say a word on the way home. We were both shocked and stunned, and we were being dropped into a situation that we knew nothing about. And I was being dropped in a situation as a caregiver that I now had to, at age of 38, take care of my mom. I had no idea what I was doing. I was going to have to give her shots. So I was going to have to be a nurse. It's like there's all these things. So we were just shocked, and we said nothing on the way home. And then over the course of the next 6 years, and yes, she lived for 6 years, not 2. So we had 6 wonderful years together, and we had very little support. We had the support of her doctor and his nurses. And until a month and a half before she passed away, I had not found a support group to join myself as a caregiver or any groups for her as a patient. So I vowed that I was going to help others. And when she passed away, I told her I would help others. And so that's what got me started in this. That's what got me in the pulmonary fibrosis community as an advocate.
That's powerful. And what a tribute to your mom to be able to bring around this thing that you saw lacking in your lives and bring that to other people. I just think that's absolutely beautiful.
Thank you.
What challenges did you witness firsthand when finding yourself faced with your mother's diagnosis?
Oh boy, many. First of all, not knowing what the disease was. Mom told me right away, she said, I'm going to rely on you to be the researcher. I'm going to rely on you to be the one that figures this out and helps me with this, because she was not that type of person. And I was. So I immediately hit the internet. I immediately hit Dr. Google, even though everybody says, don't go to Dr. Google. Dr. Google can actually be really good if you know what you're looking for and what not to believe and what not to look for. You try to use your better senses and make sure that what you're reading is legitimate. So I hit the internet and I started trying to learn as much as I could about IPF. And something I want to throw in here, because this is really important, but at the time, I thought IPF was the only form of pulmonary fibrosis. I actually didn't learn until after Mom passed, well, maybe a little bit before Mom passed away or after Mom passed away, because I was in this caregiver support group that I found a month and a half before she died. I found out that there are over 200 forms of pulmonary fibrosis. Mom had one. She had the most, yeah, right? She had the most prevalent form of the disease. And at that time, IPF was about 75% of all pulmonary fibrosis diagnoses. So it was the most prevalent. And it still is the most prevalent, but its prevalence is going down because doctors are finding that many IPF patients are misdiagnosed and they actually do have a cause. So, sorry, off the track a little bit, I'll go back. So anyway, I just wanted to kind of throw that in because it is really important for people to know that. So back to difficulties that I experienced. So I had to be her nurse. I had to know symptoms to look for. I had to know how to react. I had to give her shots. They didn't actually teach me how to give her shots. I had to give her injections of interferon gamma A. Oh, shoot. I can't remember if it's gamma A or gamma B, but I had to give her interferon shots. And they showed me the needle. They showed me the vial. They told me how to fill it. They didn't show me how to fill it. They didn't have me practice filling it. They didn't have me practice poking the needle in anything. I just was given these vials of medication and needles to take home and told how to give my mother a shot. So that was an interesting concept. And it was okay. I learned. But as a caregiver, we are thrown into this environment where all of a sudden we are caregiver, plus we're whatever our relationship is. In my case, I'm daughter. Some people are husband or wife or aunt or uncle or parent even, and so I'm her daughter, I'm her friend, I'm her caregiver, I'm her nurse, all of these different things. And it's very daunting on you, especially when you're 38 years old. So I had to learn. Learning was an obstacle because there wasn't a lot of information about IPF out there at the time. I was lucky. Mom's doctor and nurses gave me their email addresses and said, if you have questions, email us. I was very lucky. I could send them an email. Many patients or caregivers don't have that ability to do that. So I did. But still, I had to learn how to react. At the time, I also had I had a 3-year-old and a 5-year-old. I was trying to work a sales business of my own, which I had to quit because I didn't have the time for it. So I had all of that. Again, here's where I was very fortunate. I had a husband who could stay home and take care of the kids if I needed to go take care of Mom. So I didn't have to drag the boys with me to the hospital every time Mom got sick. And it was a lot over the course of 6 years. I had countless trips to the emergency room or the urgent care, countless appointments in general. So there's all of this. I had to manage her schedule and mine. I had to manage her medications. She had a lot of medications. So I had to help her manage that and make sure that she was getting the medications at the right time and getting the right meds. There was a lot to it. I was also having to deal with the fact that my mother is going to die. My mother was my best friend. We were very, very close. So for the first year, it was tough for me. I actually ended up taking anti-anxiety, anti-depression meds myself because I could not mentally deal with the fact that my mother was going to die. Even though my mother was 64 years old, and I knew at some time I was going to lose my mom, I couldn't mentally deal with it. So I had that challenge as well. I had to help her with, the doctor told us, get all of your affairs in order. So I had to help her with that. We had to, she didn't own a home, so we didn't have to worry about that. She didn't have a lot of assets, so she didn't have to really worry about a will. But, we did talk about personal belongings, who they were going to go to. We talked about her final wishes. What do you want? Do you want to be buried or cremated? They're all of these things. I actually flat out asked her, what would you like for a memorial, Mom? How do you want us to remember you? And fortunately, she was open with me and honest with me and told me what she wanted. So together, we kind of had to do all of that. We had to do all of that planning. It was just so overwhelming. And like I said, there were appointments and urgent care and ER visits. There were many calls in the middle of the night where Mom would call me and say, I've got an ambulance here. I'm on my way to the hospital. I would have to just jump out of bed and go. So things like that. It was very tough learning that.
Calling all Spoonies. As a host of a chronic illness podcast, nothing lights up my day more than hearing from you, our incredible listeners. Whether it's a topic close to your heart that you want us to uncover, or you are keen to show your own journey as a guest on our show, your voice matters. Living with chronic illness can often feel isolating, but through the power of podcasting, we can come together as a community to uplift, educate, and inspire one another. Your stories, insights, and questions drive the conversations we have and the topics we explore. So if there's something on your mind, a story that you are just itching to share, or a guest you'd love to hear from, don't hesitate to reach out. Your voice is not only welcomed here, but celebrated. Let's continue to amplify the voices of those living with chronic illnesses and create a space where everyone feels heard, supported, and empowered. Together, we are stronger.
I can only wrap my head around that a little. There's so much to go into play for that and so many things to take care of. And to be caring for your own children and your family, it's a lot to take on. As an advocate and an educator in the pulmonary fibrosis community, what is the single most common reason you hear from people about getting their diagnosis?
It takes a long time to get it. And it did with Mom too. Mom was diagnosed from her early 40s with emphysema. Because she was a smoker, they just automatically said your dry cough and your shortness of breath and the clubbing of your fingers, because she had clubbed fingers as well from her early 40s, is emphysema. Now, shortness of breath and clubbing of fingers are a symptom of emphysema. Dry cough typically isn't. Emphysema patients have a productive cough because they get a lot of mucus in their lungs. Again, while she had emphysema, that wasn't her biggest problem. It was the IPF. And the dry cough is a hallmark symptom of pulmonary fibrosis, especially IPF. So for 20 some odd years, doctors didn't do the testing that they needed to do to find her actual disease. And this is what a lot of patients go through, especially, unfortunately, female patients. Doctors don't listen to women. We're automatically told you have anxiety, and yes, a lot of us have anxiety because we have so much going on that we don't know what it is. And so it's giving us anxiety, but that's not our underlying problem. With Mom, because she was a smoker, they just said, oh, you have emphysema, and shoved her out the door, told her to quit smoking. It took until 2003 and the age of 64 to finally get the right testing to find out the right disease that she actually had. And this is the biggest problem for pulmonary fibrosis patients. Is the time to diagnosis is huge. It is years. And for Mom, it was probably over 20 years. She did tell me that she remembers as a child not being able to run and keep up with the other kids. She'd be short of breath, running, trying to keep up with her friends. So she feels that it's something that she might have actually had since birth, basically, which is a scary thought because the heredity of IPF is now somewhere upwards around 20%. So when Mom was diagnosed, they thought the heredity to be 3 to 5%. Fast forward, where are we? 19 years later. Now, as more study goes on into the hereditary factors of the disease, it's probably more like 20%. And yes, I do get followed for my lung health by her pulmonologist. So far I don't show any symptoms of the disease, but I'm 57, and who knows what my future holds. If I do end up with it, then we will be going down the road of hereditary testing to see if it is hereditary in her family. But Mom, her symptoms started in her early 40s. She didn't get diagnosed until 64, and that was actually she was 64 in 9 months, so she was almost 65 at diagnosis. That is the biggest problem for patients, is they can't get that diagnosis. And a lot of it is just it's lack of knowledge in the medical community about this disease and not listening to their patients.
What do you think patients can do differently?
They need to research. As my generation gets older, my generation is getting better at that. Like I said, I'm 57. So my generation is more into taking control of our lives. We tend to be the ones that are going to get on the internet and start looking up information. My mother's generation, they trust their doctors implicitly. Their doctors are never wrong. Their doctors have their life in their hands, and they trust that. My generation, not so much. So we need to, as a general population, and as someone who is symptomatic, we need to be finding that information. We need to be our own researchers, our own medical researchers. There is so much information out there, and we need to find it. So we need to start doing more of that and not diagnosing ourselves. I don't want anybody to think that I'm saying go to the internet and diagnose yourself. Do not go to the internet and diagnose yourself. What you can do is you can go to the internet and you can type in shortness of breath, and you will find all of these different reasons. So then you start looking at those things and you start kind of trying to say, okay, I have a shortness of breath and I have this and I have that. And it kind of more closely matches this disease, but maybe not so much that disease. Make your list of questions. Go to your doctor with your list of questions and tell your doctor every single symptom you have. Don't hide anything from your doctor. That's the other thing. Patients need to be honest. Anybody who's ever watched House has heard him say, patients lie. And it is true. I am a pulmonary fibrosis advocate, and I can tell you from experience with patients in my support group, patients lie, not necessarily on purpose. Sometimes it is on purpose. Sometimes it's because they don't know to say something. They don't think that this little thing that's going on is a symptom when really it is. So tell your doctor everything, anything that is new or different or worse, tell your doctor, because it could be a symptom. I know we don't want to sound like hypochondriacs, but we need to be open and honest in order to give our doctors the information that they need to try to diagnose what's going on with us. And ask for referrals. When you go to your general practitioner and your GP can't diagnose you, or your GP diagnoses you, but you're not getting better, ask for a referral. If you're having problems with your breathing, you ask for a referral to a lung disease specialist. If you're in the United States, it's a pulmonologist. If you're in Canada, it's a respirologist. Whatever country you're in, you get to that lung disease specialist as soon as you can. There is a reason why specialists exist, and you need to try as hard as you can to get there. If you get to that specialist and that specialist either can't diagnose you or diagnoses you, but you're still not getting better, then you need to find someone else. In the case of pulmonary fibrosis, most pulmonologists have a knowledge of it, but they don't have a strong knowledge of it. It's not something that most pulmonologists can actually diagnose really easily or really well. And they also don't know the standards of care for treatment and how a person can manage the disease and how the doctor can manage the disease. And this is a really tough thing when it comes to PF. We need better education in our pulmonary community. And the pulmonary expert, the pulmonary fibrosis experts that I have met over the years all agree, and they are working on that, but it takes time. If you can imagine trying to re-educate the entire world of pulmonary medical specialists, it takes so long to try to do something like that. So patients have to advocate for themselves. If they're not comfortable advocating for themselves, they need to get a close family member or a close friend who can come in and help them and help advocate for them. I get that a lot of people are private and they want to keep their medical stuff private, but the best thing you can do for yourself is get someone to help you and get someone to advocate for you, which is exactly what I did for my mom. And now what I'm doing for others.
I could not agree with you more. And we also need everyone to stop playing down our symptoms.
Yes.
We need to be, like you said, we need to be honest, even if it seems like the smallest tiny thing that doesn't even matter, they need to know, because they cannot point us in the direction of the help that we need if we are not sharing every little tiny, okay, maybe I have a little bit of a cough and I don't think it's anything. They need to know.
Right.
100%.
Right. The worst thing to do is say, oh, I have a cough, but it's just allergies. Really, you just diagnosed yourself in saying that. So tell your doctor.
And what kind of allergy causes a cough every single day of your life?
Exactly.
What are the most common symptoms of pulmonary fibrosis?
The most common symptoms of pulmonary fibrosis are shortness of breath, especially upon exertion. So, you're sitting in a chair and you're just fine, but you get up to walk across the room, or you're going upstairs, up a slope, climbing a hill, carrying the groceries in, taking your shower, exercise, things like that. If you're becoming short of breath and you didn't used to be, that's a concern. Another symptom would be that dry cough, that dry nagging cough that you just can't get rid of, especially if you've already been treated for some respiratory illness. If your doctor has you on allergy medications, or your doctor has you on antibiotic because, he thinks you have a respiratory infection, things like that. If that cough is not going away, that needs to be explored. Clubbing of the fingers. It's kind of hard to explain, but easy to look up on the internet. When you have clubbing of the fingers, your fingers, they take on a different shape. Your fingernails especially. So if your fingers and fingernails are starting to look odd and look club-like, that's because you're not getting enough oxygen to your extremities. So that's a problem. Those are the three most common symptoms. There's also unexplained weight gain or unexplained weight loss. There could be joint pain, joint stiffness. I'm trying to think of some of the others right off the top of my head. Those are the big ones. So you need to see your doctor. And now with COVID, we have even more. It's causing problems.
Well, and those kind of symptoms, they can be mistaken for just about any other kind of disease, right? Do you have any examples of something they could misdiagnose it for?
COPD is the first one, especially if you're a smoker. But there are other forms of COPD that people can get. Asthma is another one. It's, easily mistaken for asthma. It can be, somebody can just say, oh, you just have, this light respiratory infection, or you have pneumonia, but it's not going away. So when it's not going away, that's the problem. COPD is actually the biggest misdiagnosis for pulmonary fibrosis in general. About 50% of the patients are diagnosed with COPD before they're diagnosed with PF.
Wow.
And they may have both. It is fairly common to have both, but for some reason, doctors miss the pulmonary fibrosis. One of the reasons why PF gets missed is because the right scans are not ordered. And this is a big problem. And this is where the diagnosis is affected. So an X-ray, until PF becomes fairly prevalent in the lungs, fairly widespread, an X-ray won't show it. And when an X-ray shows it, it doesn't necessarily show up as scarring. It just shows up as something's going on in the lungs, but they can't really distinguish it because it's an X-ray. X-ray is made to look at bones. It's not made to look at tissue. Now, X-ray does show air, so when you see the lungs on an X-ray, they should be black because that's air on an X-ray. If there's space that's white, that's a problem. X-ray is not a good way to diagnose PF. You need to have a high resolution CT. Now, here's the problem. Patients go to the doctor and the doctor might order a CT, but he or she, the doctor might order just a regular CT, not a high resolution CT. Or the doctor might order a CT with contrast. Though a regular CT and a CT with contrast are not the CTs needed to diagnose pulmonary fibrosis. It is a high resolution CT, because a high resolution CT not only shows the scarring itself, it also shows where there's air trapping going on in the lungs, which does happen in COPD quite a bit, and in some forms of PF. And it shows the scarring pattern. So there are two scarring patterns that are prominent with pulmonary fibrosis. One is a honeycombing pattern. So it looks like a honeycomb. And that is the scarring pattern that is typical with IPF. The other scarring pattern that is not typical with IPF is what's called ground glass opacities. Or is it opacities? It's one or the other. Anyway, it looks like ground glass. This isn't just PF, though. There can be other lung diseases, apparently, that you see ground glass on, that pattern on a scan. One of them, now they're seeing it with COVID too. And so now they've got to find out, is it PF or is it something else? So those are the two scarring patterns, and you don't typically see those in an X-ray, and you may not see them even in a regular CT unless the scarring is really significant. So they need a high resolution CT. Now we come down to, in the United States, we have insurance issues. A patient might go to the doctor and the doctor orders a regular CT, doesn't find the PF. The patient needs to go to another doctor to get a second opinion, and their insurance won't cover another CT because one CT's already been done. But it was the wrong CT. Or an X-ray was done. Wrong scan. So these are all things that people have to deal with, and it's very difficult to move past this sometimes. So this is where, as prospective patients, this is another thing to try to learn before we go to our doctor. If we're looking for certain diseases, we may need specific types of testing. And we need to ask our doctor, should we have this or this done? And it comes down to education. There is very good information out there about PF and about what types of testing should be done. I have it on my website. It's on other websites as well out there. So people need to be doing their homework, and they need to go in with that list of questions. And I hope I didn't get too far off track on that, because now I feel like I did.
Sorry, I had myself muted.
That's okay.
No, you did not go off track at all. But so the next question, I'm going to kind of tweak it, because what I'm gathering out of what you've described is it's not very easy for them to give the proper diagnosis, even if you're seeing a pulmonologist, because if someone else did the wrong scan or the wrong CT or whatever, it's going to slow down the progress. It's going to mess with insurance. And so how can you get that proper diagnosis when you've got a mess on your hands like that? Am I right? Did I get that right?
Yes, exactly.
So what is the most important thing someone with pulmonary fibrosis symptoms can do to help get their diagnosis earlier? Is there anything?
There is, but it's tough. So it comes down to doing your homework. It comes down to finding the advocacy help, finding the right people to talk to find out the right place to go. So in the United States, we have one foundation, the Pulmonary Fibrosis Foundation. They have set up what is called the Care Center Network. A Care Center Network is a network of interstitial lung disease specialty clinics across the United States that have been identified as having pulmonary fibrosis specialists. So we do not have a specific designation for a pulmonologist who is a pulmonary fibrosis specialist. You know, we have for cancer, we have doctors who have the designation of being an oncologist. They specialize in cancer. We really need a designation for doctors that are PF specialists, but we don't have it. So these pulmonologists have been identified in, I think it's upwards of around 70 different care centers now around the United States, which for the size of this country really isn't a lot, but at least we do have them identified. So if someone is having these symptoms and they can find this list online, then they can look and see, is there a Care Center Network site near them? You know, for instance, I'm in the Seattle area. So our Care Center Network site is the University of Washington Medical Center in Seattle, which was actually the first Care Center Network site that was classified, because that's where Dr. Ragu is. So he is, we got lucky. I don't know how we drew the lucky straw, but he is the world expert in pulmonary fibrosis. So we are lucky. So there are many Care Center Network sites around the country, and it's best if somebody can find this. I also have information about Care Center Network sites on my website. I try to keep, I try to make sure that I get people to the right places. So if they can find that and draw the lucky straw and get to, words are hard, and get to the right center, then they have a much better chance of getting that correct diagnosis. They also have a better chance of having a doctor who is going to be able to go up against an insurance company and say, yes, I know that this patient already had this scan, but that is not the correct scan, and we need to do this, and getting that covered under insurance in this country. So that does help. I hope that answers the question.
I think so. In your opinion, what can doctors do to reduce the time to diagnosis, along with reducing a misdiagnosis?
One of the things that doctors can do to reduce time to diagnosis is stop chronically treating a patient who is not getting better and refer them up. Don't assume you know everything. Doctor, I have the utmost faith in doctors. Doctors are incredibly educated, but there is so much out there when it comes to disease. There's no doctor that knows everything, not one. So if your patient is not getting better within a reasonable amount of time, refer them to someone else. Find another doctor who can put eyes on them, who can listen to them, who can test them, whatever, to help find what is going on with them. So refer them up.
Absolutely.
Yeah.
In your experience, what are the main causes of pulmonary fibrosis in the people that you've met?
Given I've been in advocacy now since 2009, I have met people from all over the world. Some have pulmonary fibrosis from tuberculosis. They get it from other types of lung diseases. Pneumonia. Chronic pneumonia can cause pulmonary fibrosis because what happens is when you have pneumonia, in order to heal the pneumonia, your lung scars. Now, it is possible to have lung scarring without having progressive pulmonary fibrosis. And this is where it becomes a bit more confusing. Someone who's had pneumonia might go to the doctor, and the doctor does a scan of their lungs and finds out that they have scarring and tells them, oh, you have scarring of your lungs. Well, scarring is fibrosis. Lungs is pulmonary. So technically you have pulmonary fibrosis, but it may not progress. So you might have a little scarring of your lungs from some pneumonia, but it's not progressive. Therefore, it's not really classified as pulmonary fibrosis in that way. Because when we're talking pulmonary fibrosis, we're talking about progressive. So, but chronic pneumonia can set up a scarring pattern that just continues to go and go and go, and it doesn't stop. The body just says, it goes in kind of an overactive immune response is what it does. It's an overactive immune response. So that, there's pneumonia, tuberculosis, COVID can cause pulmonary fibrosis. We have many, many patients now in my support group network with COVID pulmonary fibrosis. So many that I just set up a separate group for those patients and caregivers who want to join that group and talk about COVID PF. Autoimmune diseases, rheumatoid arthritis, lupus, things like that can cause pulmonary fibrosis. So it's really important for patients with RA to watch their lung health.
And I'm going to pause you right there because so our listeners know, I want to let them know that you and I have talked about this previously, and you educated me, as hopefully people realize by now, I have rheumatoid arthritis. Mm-hmm. And so what do I need to watch out for?
First of all, one of the things you should do is you should find a pulmonologist who knows PF, and you should get baseline testing. You should have a high resolution CT done of your lungs. You should have a 6-minute walk test. You should have a very good physical exam where they take time, more than just a few seconds, take time to listen to your breath sounds. So they put their stethoscope on your lower lung, your middle lung, your upper lung, and they listen to you breathe, and they listen for this crackling. And this is, sorry, I forgot this earlier. This is another hallmark symptom of PF. We have different breath sounds for different diseases. If you have pneumonia, you have one kind of breath sound. If you have pulmonary fibrosis, you have another. If you have COPD, you might have another. So with pulmonary fibrosis, what they hear when they listen to you breathe, they tell you take a deep breath in, right? What they hear with pulmonary fibrosis is they hear this crackling, and it sounds like Velcro separating. It's a different breath sound than what they would normally hear with something else or with healthy lungs. This is not an easy breath sound to hear. There's actually videos out on YouTube that have audio of different breath sounds. And so you can go and listen to them, and it's very hard to hear. It takes someone who's trained to know what they're listening for to hear it. So having that physical examination is really important. And having the pulmonary function tests, which are those breathing tests that people hear about that they have to go in for when they have asthma or COPD and things like that. Having the pulmonary function testing done to find out how their lungs are actually performing. And here's another twist to this. When many people go in for pulmonary function testing, there's one test that is not always done, and it is one of the two most important tests for diagnosing pulmonary fibrosis, and it's called diffusion capacity, or it might show up on a report as DLCO or TLCO. So D is in dog, LCO, or T is in Tom, LCO. This test tells them how well the lungs are doing the gas exchange, removing the carbon dioxide from the blood and infusing it with oxygen. So the DLCO test, when you go into the pulmonary function lab to have this done, they have you breathe into the tube, but they put you in this little chamber. And through the tube, you are going to be breathing a little bit of carbon monoxide. Not enough to hurt you, but you breathe in a little bit of carbon monoxide, and then you breathe out. And then they prick your finger and they take some blood. And they check your blood for hemoglobin. So with all of these different things, between the way, I don't know all of the ins and outs of how this test works, but between they're looking for how well that carbon monoxide is getting removed from your blood, getting cleaned out of your blood and replaced with oxygen. And then they adjust it for hemoglobin, because hemoglobin does something to the number. So when that test is not done, that is not really a full set of PFTs when they're looking for something like pulmonary fibrosis. You need that test done. That test is one of the most important. So most people don't know that they should have that test. They may go in for for PFTs and not have that test done, but they don't even know they need that test. And if that test is not done, they can easily be misdiagnosed. So there are two numbers that a PF specialist is looking for in those PFTs. They're looking for FVC, which is forced vital capacity, and they're looking for DLCO. Your FVC and your DLCO can both go down as the disease progresses. However, in the case of someone who has COPD and IPF, which was the case of my mother, their FVC can stay up while their DLCO goes down. So if a doctor were to forget or not order that DLCO, they might look at the FVC and go, oh, you're fine. My mother's FVC, my mother's forced vital capacity never went below 90%. A normal forced vital capacity is 80% higher. So if they had not done that DLCO test in her PFTs, they may have not found that she had IPF. One test. And it's very overwhelming because the general population doesn't know this. I have talked to numerous pulmonary fibrosis patients over the years who did not have that test done. So it's a biggie. And then back to causes. So like I said, autoimmune diseases, right? So people with RA, people with any autoimmune disease really should have the baseline HRCT, the 6-minute walk test, the PFTs, and a good physical exam. That way, if you start having problems, watch for shortness of breath, especially when you're exerting yourself. Watch for that dry cough. Don't panic if you get a dry cough. It might just be, it might be your throat is dry. I sleep with a fan by my bedside. So my throat is dry and I have this cough that has started, and it started ever since I started sleeping with the fan by my bedside. So, and I bed checked, so I know that it's not PF. I know that it's just the fan. But watch for things like that. If you're feeling like you're, if you're a person who exercises, especially, and all of a sudden you're feeling like, wow, I can't, I don't have the stamina to do this anymore. That's a trigger. That's something that should trigger in your mind that you need to see a doctor. There are many people who are athletes, and then all of a sudden, they realize, wow, I can't swim as much as I used to swim before. I can't run that 5K that I used to run. Or I ran that 5K in 25 minutes, and now it's taking me 35 minutes to run that 5K. What's wrong? That is something that they should look for. So other causes, there are environmental causes. We breathe in everything that's in the air around us. And there's nothing we can do about that short of wearing a respirator. So we have to breathe. Therefore, we're going to breathe in everything that's around us. If you're in a situation, if you're a farmer, it's actually called farmer's lung, but if you're a farmer, you're breathing in all of this dirt. There's bacteria and stuff in the soil that can actually cause pulmonary fibrosis. People who work around a lot of vapors are not good. Painters, like my mother working in a plastics plant, who knows if maybe that set things off? We don't know. We have no way of knowing. So if you're breathing in a lot of vapors, bird exposure, believe it or not, hypersensitivity pneumonitis is a form of pulmonary fibrosis, and it is caused by environmental exposures and primarily birds. People who work with birds a lot, say you've got chickens, or you're out there working with the chickens all the time, or you raise birds, or you work in an aviary or whatever. People who have a lot of birds, even people who have birds in their home, can actually get PF from their birds. And what's happening, because it's called hypersensitivity pneumonitis, it is a hyperactive immune response to what your lungs are detecting as being an allergen. Your lungs are allergic to this, and they don't like it. So what happens is it starts to scar. The theory a long time ago used to be you remove the exposure, you stop the progression. I can tell you from experience, as an advocate, I have 14,000 people in my support groups. I can tell you, no, hypersensitivity pneumonitis can progress, and it does progress in many people. So that's another cause. There are so many causes. People who are in the hot tub all the time, the vapors that come up in the steam from the chemicals that are used to clean the hot tub, that can damage their lungs and cause PF. So lots and lots of different causes. And of course, smoking and vaping. Vaping's bad now. Vaping is actually destroying lungs faster than cigarettes ever did. Not that I want anyone to smoke, but don't vape.
So once someone is diagnosed with pulmonary fibrosis, what are the next steps that they should take?
The first step is medical. When you're diagnosed with pulmonary fibrosis, the first thing that you need to realize is that your lungs and your heart work together. So get a good cardiologist. Get a checkup on your heart. Start watching your heart health. When my mom was diagnosed, her heart was actually, aside from the congestive heart failure, because she had so much fluid in her lungs, once we got the fluid out of her lungs, got her CHF under control, her heart function was still very good. Her heart was very healthy. We just had to keep her on a low sodium diet, because what happens is when the lungs aren't functioning well, the heart takes a bigger hit, because the heart has to beat faster. It has to do more. It just has to do more work. So you want a good cardiologist, because your heart will take a hit eventually, and your heart will give out eventually. So you want to watch that. And there are many things, there are so many heart medications actually out there that doctors have at their disposal to help the heart function better when the heart function starts diminishing. And, mom had problems. She developed a low ejection fraction, which meant that her heart was not pumping blood out fast enough for her body. So they put her on a couple of heart medications that helped her heart, brought her ejection fraction back up. So that was better for her. All kinds of things, managing congestive heart failure. When mom was diagnosed in 2003, she was actually diagnosed end stage So she was in the end stages of the disease, and she lived for 6 years. End stage PF does not necessarily mean you're going to die tomorrow. End stage PF can go on for a very, very long time, for years. So you have to manage that. The other doctor that every single pulmonary fibrosis patient should see is a gastroenterologist. Acid reflux is thought to be a cause and definitely is known to exacerbate existing PF, make it worse. So you want to make sure that you don't have acid reflux, and you want to get it under control if you do. Mom did not think she had acid reflux because she had silent reflux. She had no idea she was having it. She didn't have those typical acid reflux symptoms that we have. She didn't have that burning in her throat or anything like that. So when she was sent to a gastroenterologist for testing, she found out she had acid reflux. So now it was time to control that. Some people have acid reflux so bad that they need to have a surgical procedure called Nissen fundoplication. Nissen fundoplication, that is so hard to say. And she had to take medication, or the people with it so bad that need the Nissen fundoplication, they don't take meds, they have the procedure. And it helps stop the reflux. So it's important to manage that. The other thing that is important for people is to find a support group. Most of the knowledge that they're going to gain about PF is going to be in a support group. It is not going to be from their doctors, unfortunately. This is not cancer. The doctors don't know it. The doctors aren't going to hand them a notebook that says, here's your notebook, all of your information, go home, read through this, do that. They're not going to get that. So they need to find support. And that is why I have the support groups that I have. So I have my online support group, and the goal is to get, support out there for people who need to learn about this disease, and then get a caregiver on board. They need to not be in this alone. There is so much that goes with this journey. And part of it too, having a caregiver to help them manage everything, as well as having someone to be at your appointments with you, because when you are on supplemental oxygen and you're having problems with oxygen saturation and breathing, you forget. It's just part of the disease. You will forget things. And so having that person with you to, the doctor might ask a question and you might answer it one way, but the other person is like, no, actually it's this. It happens all the time. So you need that caregiver.
Sorry, I'm trying to wrap my head around how to ask this one. Okay, so what are some of the common questions you hear from loved ones of newly diagnosed patients, especially ones that are new to caregiving? Do you have advice for them?
That's tough. My advice for them is to learn as much as they can, especially about oxygen, because that is the lifeline for a PF patient. We do have a couple treatments now, so learn about those. I make sure to tell them that the disease is progressive. This is not something that's going to get better. They need to understand that. I am very real with the patients and caregivers in my support group network. We don't sugarcoat this. It's actually better that everybody knows what this disease is. We have many who come into the support group, patients and caregivers both, who the doctor did not tell them that this was progressive and terminal. If they'd been diagnosed with cancer, they would have been told, but not with this one. So that's a problem. That is something that we have to tell them. They need to not only educate themselves on caring for their loved one, but they need to educate themselves on caring for themselves. As a caregiver, it is really, really important to not forget to take care of you. If you can't take care of you and something happens, then you can't take care of them. Been there, done that. I developed many medical problems of my own. Fortunately, nothing terminal, but during the time I was taking care of my mother. And I put myself aside, and it is 13 years later since my mother passed away, and I'm still playing catch up. Take care of yourself. Take time for yourself every single day, even if it's 15 minutes to just go for a short walk. You do not have to be with your loved one 24/7. You can't be with your loved one 24/7, and you need to be real about that. You need to face that. So take care of yourself. A good friend of mine, she was taking care of her husband. She was starting to have some medical problems. She kept saying, I don't have time to go to the doctor. A few months later, she finally went. She found out she had advanced pancreatic cancer. And 3 weeks later, she was gone. So you really have to take care of yourself. You have to put yourself first.
Can you walk us through a time when you realized your mother wasn't getting the care that she deserved, and when you decided to get more involved and speak up for her?
So aside from her IPF diagnosis, there was a time that she wasn't getting the care she deserved. She had major back problems. She was having some problems with her hip, and they, of course, sent her to physical therapy. It's the first thing that they always do because the insurance company requires it. So they sent her to physical therapy without any scans, nothing. Just sent her to PT and said, get your hip, get exercises and strengthen your hip. So physical therapy wasn't helping. In fact, it was making her worse. She was in more pain after physical therapy. So then the doctor finally was able to order an MRI, found that she had a nerve that was being pinched in her hip. And it wasn't like a pinched nerve in your back that you can just, exercise, stretch out, whatever, make that go away. It wasn't something that was ever going to go away. It was something that was actually surgical. And her first doctor said, well, you have IPF, advanced IPF. We can't do surgery. Mom was getting worse and worse and worse. It finally got to the point where she could not do anything for herself. She couldn't walk. She couldn't use the restroom on her own. She couldn't shower on her own. She definitely couldn't cook a meal. She was living at my house and living on my couch because I have a 2-story home. We couldn't get her upstairs to the guest room either. So she was downstairs. So I pushed to get a different doctor. And because she was on Medicaid, of course, we had to go through the whole, referral process of getting her to a different physiatrist. So we finally got her to a different physiatrist who took a look again at her scans and said, yeah, you need surgery. And this was in 2007, I believe. So he finally agreed to refer her to University of Washington Medical Center again, to the neurology department. And so she started seeing a surgeon there, and the surgeon said, yes, you do need surgery. And we worked with her pulmonologist and her cardiologist to get her all kinds of testing and clear her for surgery. She was on 6 liters of oxygen at the time, supplemental oxygen, which is quite a bit for a normal person, not quite a bit for a PF patient, but for someone else. And of course, she was end stage, right? So her lungs were pretty fibrotic. She had surgery. They did it at University of Washington. They put her in cardiac care right away in CCU after surgery as a precaution. They didn't necessarily know that she'd need it, but they did it as a precaution because she was a PF patient. And she actually went through surgery fine. And once we got her through, healing at the hospital, a couple of weeks of rehab, and then home, she was great and went back to being able to walk again and do things for herself. So sometimes you have to push. Sometimes you have to demand. And we did. We had to demand. I had to demand. I had to flat out say, I'm sorry, no, she needs this done. She can't just live the rest of her life in excruciating pain on my couch. My mother was taking morphine and had fentanyl patches for pain, and it was not controlling her pain. She was in so much agony. When her neurosurgeon came out to talk to me after surgery, the doctor told me when we got in there, we noticed there was like all these little cysts inside that little area that nerve runs through. And so they basically cleaned it all out. And that nerve now had room. So you have to push. And we have to do it a lot in medicine, or our own medical care. It's awful.
It's okay to be loud. It's okay to speak up, and they are not always right. They don't always have the right answer. And it's okay if we have to just say, no, look again. No, look, do more. So
you have to know your body, and in the case as a caregiver, you have to know the body of the person you're taking care of,
absolutely.
Listen to them, watch them.
So September is Global Pulmonary Fibrosis Awareness Month. Can you talk a bit about what that means and how it can be effective?
So everybody in the PF community in September is going to be hitting social media hard with information about pulmonary fibrosis, trying to raise awareness, trying to raise money. If, you might see donations out, donation requests out there for people to raise money for pulmonary fibrosis research, things like that. So this is what September is all about. For me, in September specifically, I will be posting daily in all of my social media something about pulmonary fibrosis, some information about the disease or tips about living with the disease. I developed the hashtag live with PF. And what that really means is it means live with PF rather than just die from it. So my goal always has been in my support group network to help people live with this disease as long as possible and as well as possible, because that is what my mother did. I learned from her. I have always been the pessimist and she wasn't. She was the optimist. She just said, you know what? It is what it is. I'm going to deal with it. And she went about her day. She did have bad days, and she allowed herself to take those bad days. And I allowed her to as well, because they're important. But she'd get up the next day and say, today is a new day, and I can make it a good day. So that was just what she did. So she lived with PF. She was a rock star. She was my rock star. She's still, to this day, she's been gone for 13 years, almost 13 years. It'll be 13 years on September 27th. And I listen to her every day. She still teaches me 13 years later. So I teach other people. That is my goal. And so in September, I will be teaching everybody as much as I can. And I encourage every single person who listens to this to get on my network, to get on my social media, to learn about PF. I want to make PF a household word. I want PF to be as common, not as common, as commonly known as cancer. I want every single person in the world to know.
Okay, so to go with that, where can everyone find you? I know you have multiple places, so let's let everyone know, where can they find you during the month of September so they can catch all this?
The easiest place to find me is at my website at www.breathesupport.org. That is the easiest place to find me. From there, you will find links to all of my social networks, or all of my social media, and you will find links to all of my support groups. So if you are someone who's having a problem, or you know someone who's having a problem, join the group, ask the questions, definitely.
And I assume there's probably a place where they can message you and ask questions as well?
There is.
Perfect.
There is a place to message me, yes. I do have a business page on Facebook.
Okay.
I've got a business page and 7 support groups on Facebook. And of course, my website, like I said, and I've got Twitter and Instagram. My website is where all of that information is, as well as how to message me.
Well, thank you so much for joining. Do you think there's anything that we haven't mentioned that you want us to toss out there?
I think the biggest thing that I want everybody to realize is, like my mom and I, we didn't know what PF was. We had never heard of it when she was diagnosed. Eventually, at some time in your life, you are going to know somebody with it, or you're going to be the one with it. I've seen it happen so much, it's one of those things that eventually it is going to become part of your life. So it's better if you just start learning now about it.
Well, thank you so much for joining and taking this time out of your Sunday so we can hurry up and let everyone know all about this. And we're going to share it on September 1st so everyone can hear and jump on and watch everything that you're going to be sharing. Again, thank you, Taleena. It's been a pleasure. And everyone, until next time, don't forget your spoon.
Thank you.
The information, opinions, and recommendations presented in this podcast are for general information only. Consult your own physician for any medical issues that you may be having. The information should not be taken as a replacement for medical, clinical, professional advice, diagnoses, or medical intervention. My Spoonie sisters and guests will not be held liable for any of the consequences of such action or inaction. Trigger warning. Some episodes may cover sensitive topics including, but not limited to, suicide, abuse, mental illness, and chronic disease. You are advised to refrain from listening if you are likely to be offended or adversely impacted by any of these topics. None of the guests or hosts will be responsible for your use of the information contained therein. Life is not merely to be alive, but to be well. Living a life with a chronic illness is best described with one word: unpredictable. Be Well's products are designed to make the unpredictable easier to deal with. Back when I was getting my infusions, I would have loved to have their adult zip hoodie. They even have one in pink. They also have everything from one-day pill holders to urgency buckets. So remember, they want to make your life a little easier. So be sure to check out Be Well.